And the tone of these addresses around, specifically around vaccines, has definitely changed over time. Initially, the president saying that vaccines would not be compulsory. Now, nobody will be held down and forced to take a vaccination, but vaccine mandates mean that people can be excluded from very important spaces if they are not vaccinated. The president speaking about transport, speaking about workplaces, and business have been calling for these vaccine mandates, saying that people should not be able to go to retail spaces unless they are vaccinated. The president saying that there is broad consensus around this in NEDLAC, and that will be looked at. So definitely vaccine mandates are coming. All right, Dakota Legote from the ANC's National Executive Committee. Let's start getting some reaction. Your response to the president's address tonight.
Thank you very much, my sister, and to all the viewers at home. As the African National Congress, we welcome the submission by our president, our commander-in-chief, and His Excellency President Ramaphosa, that will not be going into any hard lockdown. And what it suggests to all of us is that the president and the committee, they will consider it in their decision to appreciate the fact that the economy of all South Africans comes first, the interest of South Africans comes first, and as the ANC, we welcome that particular position because it's a good gesture. And what we are not happy about as the African National Congress is that for South African scientists to be scholarly in appreciating the fact that there's a new variant, there are new stories and new punishment for doing that. And I don't think it's good. And in South Africa, we're getting this particular punishment for the second time, because we remember even during the era of President Thabo Mbeki, when he raised the question about the HIV/AIDS, as a country we're punished for becoming a litmus test of the world and globe on the matter of HIV/AIDS. We're also now being punished for being a leader and a trailblazer on the issue of the variant on COVID. And I don't think it's fair for us as a country, because we are honest to the world, we are honest to the global players. It will not be correct for them to make abrupt decision, to punish us as a country, to block us as a country, in particular the United Kingdom, which is our former colonizer, because they have the burden of leadership after hating us for over 300 years, to appreciate the fact that they need to help us to grow, they need to help us to be proper people. But if they are going to be the first one through their prime minister, I don't think it helps us as a developing nation to be where we're supposed to be. But secondly, is the fact that as a country, we did our research. Our researchers and scientists were among the first in the world to realize the incoming variant, Omicron. And I don't think that for that particular factor, we need to be punished. I mean, not even China was punished for COVID-19. What the UN and the World Health Organization did was to agree on an investigation, and I think it will only be fair for us also that if there's anything wrong scientifically, scholarly, and otherwise
all right, Mr.
that needs to be done, would be for research.
We appreciate your response, agreeing with President Cyril Ramaphosa tonight that those travel bans imposed by many countries around the world are completely unjustified. The President calling for those to be reversed urgently. We know that government is working behind the scenes. The Department of International Relations saying that it has been assured some flights from the UK will pick up this week. The DA's John Steenhuisen with us right now. Your response to the President's address.
Thanks, Francis. I think there's lots to agree on this evening. It's very glad and gratifying to see government moving away from using lockdowns and liquor bans and bans on beaches, etc. I think this is a lot more of a sober response, and certainly a lot that we can associate with. I think it is the right response, and we agree with the President around the irrationality of the travel restrictions that have been implemented against South Africa, and we will certainly be using our mayors and our premier to drive the message to particularly these countries, ambassadors and others, that this is the wrong decision, and that in fact South Africa remains a destination like any other in the world that is safe to come to, and that these bans that they've imposed are irrational and unreasonable. So I think there's a lot to agree with this evening. Very hard to fault anything that the President has said this evening, particularly given the soberness of it. And as I say, the fact that there's no economic restrictions. Of course, I would like the curfew to have been lifted, but I suppose you can't get everything.
All right, thank you very much for that reaction, John Steenhuisen from the DA. And we will be speaking to the EFF. We're bringing you reaction to what the President said tonight, saying that we are on hold, no further restrictions. They're watching infections, and we are expected to head into the fourth wave. But what's different this time is that people are vaccinated. And of course, many believe that is also a response to the pleas of business, to the pleas of tourism, not to impose anything harsh right now. South Africa already being punished by the travel bans. All right, the EFF's Veronica Mente, National Chairperson, your response to the President's address.
Thank you very much, Francis, for having us. First and foremost is that on the travel bans, the travel bans that have been imposed, especially into the African countries, is actually a lesson to the African continent and its leadership. They are showing them how to lead, and they are showing them how to be decisive in leadership. Africa, as it stands now, we are not having our own pharmaceuticals where we are producing these vaccines, and the fear is that the travel bans are going to delay the delivery of the vaccines, which is not supposed to be the case. And therefore, it means that we cannot be dependent on the West. We ought to stand up on our own. We ought to have our own pharmaceuticals that are developing every kind of medicine, which is of assistance to our health as Africans. And in terms of the virus and the level which was declared by the President today, there is actually no reason for anyone to be saying anything right now, because we just come out of elections. All of us, we had gatherings and nothing was untoward and nothing was actually fearful during those times. And therefore, if people of South Africa are now almost getting the message of vaccination and vaccinating, and they are keeping up with the regulations of the COVID in terms of washing hands, keeping safe, sanitizing and wearing masks, there shouldn't be any problem.
All right. Thank you very much, Veronica Mente from the EFF. Next up, reacting to what the President said tonight, the IFP's Nkoleko Hlengwa, your response to what the President had to say.
Thanks, Francis. Good evening to you and the viewers. Well, at the outset, I think it's important that there's continuation of the international dialogue that has to happen, particularly between the regional blocs, the African Union and the EU, to push back on the frontiers of the panic and the irrational decisions that are being taken insofar as travel bans are concerned. The circumstances have wholly changed from when the virus actually emerged 2 years ago and what we have now. And so really there has to be a sobriety sobriety of mind and the pushback on what is clearly, Afrophobia and a reckless and irresponsible action step, which has been taken by European countries in this regard to cause international panic. So we really are calling on DIRCO to be at the forefront of these diplomatic engagements, and so that sanity can actually prevail. The second point is that obviously the president tonight was working a very tight balance coming out of an election campaign which really, for all intents and purposes, saw things pretending as though there was no COVID-19, and so that balance was important. What we are saying, of course, this was a pragmatic outlook, which is rational and responsible under the circumstances, so that all the variables can be discussed. We are continuing to call on South Africans to exercise maximum discipline of adherence to the preventative protocols which are in place to push back on this virus. And we are, as the IFP-NEC, going to be meeting on Friday to finalize our submission on the issues of the vaccine mandate, and we believe this is a discussion that South Africans need to have. But obviously, it is very true that vaccination is probably the most important program which must be rolled out currently. And once again, we are saying to government, we need to beef up the capacity of our healthcare infrastructure to meet the demand and the risks that are actually there. But the IFP is all in all saying to South Africans, it continues to be in our hands as government tries to really navigate the politics of this matter with much confusion.
All right, Mr. Klengwa from the IFP, thank you. Voter Wessels from the FF Plus joining us now. Your response.
Thank you so much. We welcome the fact that the president did not announce any further restrictions. That is good because it has always been about balancing saving lives with protecting livelihoods. And at this stage, the risk to livelihoods are also threatening lives just as much as COVID-19. And then we are worried about the uncertainty that there is and the fact that it might be a repetition of December 2020, when the president at the start and the beginning of December also did not actually impose any restrictions, and then mid-December closed beaches, and then at the end of December closed liquor sales. So we won't want to have a repetition of the uncertainty, because that's also detrimental to holidaymakers, to the tourism sector and the restaurant sector. And we would want certainty in this regard. And what he announced with regards to actually imposing health protocols, that is important, and we call on South Africans to stick to those health protocols. That is the answer. No further lockdowns, no further restrictions. That is important.
All right, thank you very much. Voter Wessels from the FF Plus. And we are going to speak to the UDM leader, Bantu Holomisa, joining us shortly. These are reactions to what the president said tonight, saying that there would be no further restrictions. South Africa remaining on lockdown level 1 for now, if you've just tuned in. So nothing changing, but reminding South Africans that there is a curfew in place and some restrictions, reminding South Africans to wear masks. And talking about vaccine mandates, and we've seen the rhetoric around this intensify with each presidential address. The president saying that there is now a broad consensus among the players at NEDLAC bringing together business, labour and government to thrash out issues, saying there is now broad consensus that there should be some form of vaccine mandates, meaning people can be excluded from various public places, possibly workplaces and transport, possibly retail as well, if they are not vaccinated. All right, Bantu Holomisa joining us now. Your response to what the president said. General Holomisa, it's Francis. Can you hear me?
Yes, I can hear you.
Your response to the president's address tonight.
The United Democratic Movement has taken note of the announcement by the presidency. In fact, we think that he has clarified a lot of confusion. So we support any plan to save the lives and the economy of this country. However, I would suggest that Parliament should not be left out in this pandemic, in the sense that we don't get full briefing. There's lack of transparency. So he needs to work with Parliament. These scientists of his must also have discipline. I don't know who mandated them to issue statements without the president and the cabinet knowing about that, let alone Parliament. So there's a need to review the strategy. It looks as though we might be shooting ourselves in our feet. We need to change the way of doing things. These people who get crazy about briefing us on TV every day, I'm not impressed with that, because other countries are not doing that. Why are we always doing this? For whom? Who are we trying to please?
All right, thank you very much for that response from the UDM's Bantu Holomisa. From the ATM, Vuyoketu Zongula, your response to what the President had to say.
We note what the President has said, and we appreciate the fact that he has not locked down the country, because it has been proven that these lockdowns are not sustainable, and it can't be that so many days, more than 600 days after the first lockdown, we only have one policy instrument to respond to COVID-19, which is a lockdown. Now, we as the ATM want to make South Africans to be aware and also caution the President that he cannot be pushing for mandatory vaccination, because a vaccination, it is a constitutional right for each and every person to decide what they let in their bodies. Therefore, they cannot be forcing people. Also, I think the human rights violation whereby employees are forced by the employers to vaccinate if they want to keep their jobs. That is something whereby we as the ATM would not agree with, because we cannot coerce people to vaccinate. But with the other elements, we note it, but we appreciate it would be more proactive as a country. We have scientists which have identified variants in our country ever since the lockdown started. However, what we're not seeing, it is the same scientists now developing vaccines. How is it that we are so good in terms of identifying variants? However, we lack the necessary expertise to develop vaccines as a country. We are just people who are just waiting for other countries to get vaccines from them, whereas we should be having vaccines. We should be developing our own medicine to respond to the crisis of the COVID-19.
All right, thank you for responding, the ATM President there. Let's go to Reverend Kenneth Mashwe of the ACDP. Of course, your response to what President Cyril Ramaphosa said today. All right, we just lost him. If you've just tuned in, you didn't hear the President earlier. No change to the lockdown level, but some concern about the Omicron variant, saying that scientists were watching that, applauding South African scientists and condemning the rest of the world that almost immediately imposed those travel bans. Calling for courage around vaccinations, talking about incoming vaccine mandates, saying there is broad consensus for that. The President tonight also talking about the booster vaccines. Right now, healthcare workers, he says, can access the Johnson & Johnson booster shots. There have been reports that some healthcare workers would prefer some of the other vaccines. Pfizer has applied, and that is still being looked at, the President confirming tonight. But saying that vulnerable people already qualify for those booster shots. People living with cancer, having certain medical conditions, they are in fact able to get medical advice, and on the advice of a doctor, they will be offered booster vaccinations. So those expected to come in for older people, over 60s, many a high uptake on the vaccinations, but now the booster shots outstanding. South Africa looking at that along with many countries in the world. Dennis Blum from COPE joining us now. Your response to what the President had to say.
Good evening, Francis, and good evening to the viewers. Francis, we welcome the decision by the President and the Corona Command Council. It is very important that this decision must not, it could have been very harmful to the economy of the country if the President put the country on level 2 or level 3 or level 4. We are very happy that it did not happen. But we must say, Francis, that we hear that the President is talking about vaccine and the importance of vaccine. We want to reiterate what we have said. Vaccine education is very important. You see, there are people who still doubt the vaccine. It is the responsibility of the government, the health department, to take those people through a workshop. I don't think that they resist or they refuse to take the vaccine.
All right.
I just want to know more about the vaccine.
Thank you very much, Dennis Blum from COPE, reacting to the President's address tonight. The ACDP's Reverend Kenneth Mashwe with us. Now, we lost you earlier. Your response?
Well, the first response is that the only thing I welcome from what the President said tonight is that he did not take us to alert level 2. That's the first thing. And also that provincial travel has not been suspended or banned. But in general, I am very disappointed to hear the President somersaulting in his approach, because last year he made a clear promise that nobody will be forced to vaccinate. Now he's talking about mandatory vaccinations without saying the reason for his changing position, without saying, I was wrong, I apologize for being wrong. So the ACDP does not agree with mandatory vaccinations. Vaccinations must be voluntary. People must choose. What we are seeing is happening all over the world is that governments are becoming totalitarians. They are promoting tyranny that the ACDP totally rejects. And we want to say to the President, other countries have had Parliament debate the issue, but he's running away from Parliament. This matter must be brought to Parliament. There is no way that the constitutional rights of people can be undermined by NCC and by government. There has to be a constitutional amendment before this matter can be taken forward. We cannot have mandatory vaccinations in the country where the whole world was celebrating South Africa's liberal constitution that was protecting the rights of all vulnerable people. Now those rights are being thrown out of the window, even by the President who played a major role in the constitution-making process of what we have today as the Bill of Rights.
All right.
That's the first thing. Yeah, we totally reject what the President is saying. Let him tell us why he has somersaulted. Let him tell us why he has changed his mind. Let him tell us, and not just treat people like children. I said it, and if I change my mind, I don't have to tell them why. There is transparency that is lacking with this government. And the ACDP would want transparency. The government must be truthful, must be honest. The President must be honest, because I now question his honesty. I question his honesty. There must be transparency, and he must accept the fact. He must accept the fact that there are who are vaccinated, who are still infecting others, who still get COVID after being vaccinated. So if you are going to force people to do something that is not 100% guaranteed that it works, it is wrong, and we will not accept that.
All right, thank you very much. Reverend Kenneth Mishwe, ACDP leader, speaking out against vaccine mandates. If you didn't hear the address earlier, the president saying that there is broad consensus in NEDLAC around vaccine mandates. That brings together business, labour and government. So there will be a task team looking at how these are implemented. What it means is that people who are unvaccinated, who cannot present vaccination certificates, may be excluded from public areas. And he spoke about transportation. Of course, this would be hugely impactful for people trying to get to work. If workplaces are allowed to introduce mandatory vaccines, already a lot of legal challenges around those, and some workplaces are trying to do that. That changes things for people who are unvaccinated. The ACDP concerned, but many welcoming. What was also said tonight is that nothing really changes. We remain on lockdown level 1 for now. No new measures in place, but just a call to have courage to get vaccinated and to wear masks, to adhere to the current restrictions, and everyone closely following developments around the new Omicron variant that was discovered in South Africa. Where it originated from, we don't know, but discovered by scientists here.